Never ignore what your body is trying to tell you, especially after the age of 60. Many people imagine a stroke happens without warning, almost like a bolt of lightning. But the truth is often very different. In many cases, the body gives subtle clues hours, days, or even weeks before a major stroke occurs. The problem is that these early warning signs are easy to dismiss as simple aging, stress, or just having a bad day. Imagine waking up one morning feeling a little off. Maybe your arm feels unusually weak, or your speech sounds slightly different. You tell yourself you'll rest and see if it gets better. But what if that small change is actually your brain asking for help? Knowing the difference could make all the difference. And that's exactly why this video matters. Today, we are going to explore 7 early stroke warning signs that adults over 60 should never ignore. These signs don't always mean a stroke is happening, but they do deserve prompt medical attention because early treatment can greatly improve outcomes. Stay with me until the end, because the final warning sign is one that many people mistake for normal aging, and it may be one of the easiest to overlook. Before we begin, remember that this video is for education only. It cannot replace advice from your doctor or emergency medical care. If you or someone around you develop sudden stroke symptoms, don't wait to see if they improve. Call your local emergency services immediately. Let's start with the first warning sign. The first sign is sudden weakness or numbness on one side of the body. This is one of the most common early signs of a stroke. You may notice your arm feels unusually heavy. Your leg might not move the way it normally does. Sometimes only your fingers feel numb. Other times an entire side of the face, arm, or leg becomes weak. Why does this happen? A stroke occurs when blood flow to part of the brain is interrupted or a blood vessel in the brain bursts. Without enough oxygen, brain cells begin to malfunction very quickly. The side of the body affected usually depends on which part of the brain is involved. Imagine carrying a grocery bag with your right hand every week without any trouble. One day, the bag suddenly slips because your grip feels weak. You might think you simply slept on your arm, but if the weakness comes on suddenly, especially on just one side, it's important to take it seriously. Some people notice their smile looks uneven in the mirror. Others discover they cannot lift one arm to shoulder height. Family members are often the first to notice that something doesn't look quite right. Even if the weakness disappears after a few minutes, don't ignore it. A temporary episode could be something called a transient ischemic attack, often called a TIA or mini-stroke. A TIA is a temporary blockage of blood flow to the brain. Although symptoms may go away, it's considered a medical emergency because it can be a warning that a larger stroke could happen soon. If sudden weakness or numbness appears, seek emergency medical care immediately. Quick treatment may reduce damage to the brain and improve recovery. Now, you might think the next warning sign would be severe pain, but surprisingly, that's often not the case. In fact, the second sign is something many people mistake for simple tiredness or nervousness. The second warning sign is sudden trouble speaking or understanding speech. Stroke can affect the parts of the brain responsible for language. A person may know exactly what they want to say, but the words come out slurred, mixed up, or don't make sense. Sometimes speech becomes unusually slow. Sometimes the person cannot understand what others are saying, even though their hearing is perfectly normal. This can be frightening for both the individual and the people around them. Picture yourself talking with your spouse during breakfast. You reach for your coffee and try to ask for the sugar, but the wrong words come out. Or perhaps someone asks you a simple question and, for a moment, the sentence doesn't make sense. That isn't something to brush off as just getting older. Healthy aging may occasionally involve forgetting a name or searching for the right word, but sudden difficulty speaking or understanding language is different. It begins abruptly and often appears alongside other symptoms. Doctors often encourage people to remember the word fast. Face drooping, arm weakness, speech difficulty, time to call emergency services. It's a simple reminder because every minute counts when brain cells are losing oxygen. Even if your speech returns to normal after a short time, don't assume everything is fine. Temporary symptoms can still signal an increased risk of a major stroke in the near future. Coming up next, we'll discuss a warning sign that many older adults mistakenly blame on eye problems. But sometimes, the eyes are actually revealing that the brain needs urgent attention. Let's continue. The third warning sign is sudden vision changes. Many people assume blurry vision is simply part of getting older. While age-related eye conditions are certainly common, a sudden change in vision should never be ignored. A stroke can affect the areas of the brain that process what your eyes see, even when your eyes themselves are perfectly healthy. Some people suddenly lose vision in one eye. Others notice double vision, blurred vision, or dark spots that seem to appear out of nowhere. Sometimes it feels as though a curtain has been pulled over part of your sight. Imagine you're reading your morning newspaper, and suddenly the words on one side of the page disappear. Or you're watching television and realize you can only see half the screen. These changes can happen within seconds, and they often catch people completely by surprise. It's important to remember that not every vision problem is caused by a stroke. Cataracts, glaucoma, and other eye conditions are also common as we age. But the key difference is that stroke-related vision changes usually come on suddenly. They don't gradually develop over months or years. If you experience a sudden loss of vision, double vision, or severe blurring without an obvious explanation, don't wait until tomorrow to see if it improves. Seek emergency medical care right away. Fast evaluation can help determine the cause and, if it is a stroke, early treatment may reduce lasting damage. And here's something many people don't realize. The next warning sign often causes people to think they're simply dehydrated or exhausted. But in some cases, it can be much more serious. The fourth warning sign is sudden dizziness, loss of balance, or difficulty walking. We've all had moments when we stood up too quickly and felt lightheaded. That's not unusual. But stroke-related dizziness is often very different. You may suddenly feel as though the room is spinning. Your legs may not seem to cooperate, even though you were walking normally just moments before. Some people stagger as if they've had too much to drink, despite not having consumed any alcohol. Think about taking your usual morning walk. You've followed the same route for years without trouble. Then one day, you suddenly find yourself drifting to one side or struggling to keep your balance. You may grab a fence or a chair because you feel like you're about to fall. The brain controls coordination and balance. If blood flow is interrupted in certain areas, even simple movements can become difficult. This is especially true when strokes affect the back part of the brain, known as the cerebellum, which helps coordinate movement. Because falls become more common with age, some people assume balance problems are simply another part of getting older. But when dizziness or unsteadiness starts suddenly, especially if it's accompanied by weakness, vision changes, or trouble speaking, it should be treated as a medical emergency. If you're with a loved one who suddenly becomes unsteady or cannot walk normally, don't encourage them to sleep it off. Call emergency services immediately. Waiting could allow the stroke to progress. Now here's a symptom that surprises many people. It isn't always dramatic, and because of that, it can be dangerously easy to ignore. The fifth warning sign is a sudden, severe headache unlike anything you've experienced before. Not every stroke causes pain. In fact, many strokes occur without any headache at all. But when a sudden, intense headache appears, especially one that reaches maximum intensity within moments, it deserves immediate medical attention. Some people describe it as the worst headache of their life. Others say it feels like something exploded inside their head. This type of headache may be accompanied by nausea, vomiting, confusion, or sensitivity to light. A severe headache can have many possible causes, including migraine or other medical conditions. But when it comes on suddenly and is very different from your usual headaches, healthcare professionals consider it an emergency until proven otherwise. Imagine enjoying a quiet afternoon when an intense headache strikes without warning. Within minutes, you struggle to think clearly or keep your balance. Those are not symptoms to ignore or simply treat with pain medication at home. The safest approach is to seek emergency medical care immediately. Doctors can perform the appropriate tests to determine whether the cause is a stroke, bleeding in the brain, or another serious condition that requires urgent treatment. So far, we've covered weakness on one side of the body, trouble speaking, sudden vision changes, dizziness and loss of balance, and severe, unusual headaches. But the next two warning signs are often the most misunderstood, and one of them can easily be mistaken for simple forgetfulness or everyday fatigue. Stay with me, because these final warning signs could help you recognize when your brain is asking for help before it's too late. Let's continue. The sixth warning sign is sudden confusion or difficulty thinking clearly. This symptom can be easy to miss because it doesn't always look dramatic. A person may seem awake and alert, but something just isn't right. They may struggle to follow a simple conversation, become confused about where they are, or have trouble making decisions that would normally be easy. As we get older, it's normal to occasionally forget where we left our keys or walk into a room and forget why we went there. But sudden confusion is different. It appears quickly, often within minutes, and may be accompanied by other unusual changes. Imagine you're paying for groceries you've bought hundreds of times before. Suddenly, you can't remember how to use your bank card or count your change. Or perhaps you're making a familiar recipe and, without warning, you can't remember the next step. These are not typical signs of healthy aging when they happen suddenly. The brain depends on a constant supply of oxygen-rich blood to think, remember, and process information. If that blood flow is interrupted, even briefly, clear thinking can become difficult. Family members are often the first to notice this warning sign. A spouse may say, "You're not making sense today," or an adult child may notice their parent seems unusually confused during a phone call. Trust those observations. Sometimes the person experiencing the stroke doesn't realize anything is wrong. If sudden confusion appears along with weakness, vision problems, trouble speaking, dizziness, or a severe headache, don't wait to see if it passes. Call emergency services immediately. Every minute matters because brain cells can be permanently damaged when they go too long without oxygen. Now let's move to the seventh and final warning sign. It's one that many people dismiss because it comes and goes. But ignoring it could be a serious mistake. The seventh warning sign is a transient ischemic attack, often called a TIA or mini-stroke. Unlike a major stroke, the symptoms of a TIA usually disappear within minutes or a few hours. That can make people believe everything is fine. Unfortunately, that's exactly what makes it so dangerous. A TIA happens when blood flow to part of the brain is blocked for a short time. Because the blockage clears quickly, symptoms improve. But a TIA is often a warning that a larger stroke could happen soon if the underlying cause isn't identified and treated. Someone may suddenly experience slurred speech, weakness in one arm, blurred vision, or numbness on one side of the face. 10 minutes later, they feel perfectly normal. They might even laugh it off and continue with their day. But healthcare professionals treat a TIA very seriously. It's an opportunity to find out why the symptoms happened and to reduce the risk of a future stroke through appropriate medical evaluation and treatment. If you ever experience stroke-like symptoms, even if they completely disappear, seek emergency medical care right away. Don't drive yourself if you're feeling unwell. Call emergency services or have someone call for you. Getting evaluated quickly could make a tremendous difference. Now that we've covered all 7 warning signs, let's talk about what you should do if you suspect a stroke. Because recognizing the signs is only half the battle. Taking the right action immediately is just as important. The first step is simple. Don't wait. Many people hope the symptoms will fade on their own. They don't want to bother family members or think they are overreacting. But when it comes to stroke, waiting can reduce the chance of receiving treatments that work best when given as early as possible. Remember the word FAST. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask them to raise both arms. Does one arm drift downward or feel weak? S stands for speech. Ask them to repeat a simple sentence. Is their speech slurred, confused, or difficult to understand? T stands for time. If you notice any of these signs, it's time to call emergency services immediately. It's also helpful to note the time when symptoms first began. Doctors use this information to decide which treatments may be appropriate. If you're not sure exactly when the symptoms started, tell the medical team when the person was last seen feeling normal. There are also a few common mistakes that can delay life-saving care. One mistake is assuming the symptoms are caused by low blood sugar, dehydration, or simply getting older without seeking medical evaluation. While those conditions can sometimes cause similar symptoms, only a healthcare professional can determine the true cause. Another mistake is waiting for a family member to come home before getting help. Every minute of delay can allow more brain cells to be injured. It's always safer to call for emergency assistance immediately rather than waiting to see what happens. Some people also try to drive themselves to the hospital, but stroke symptoms can suddenly worsen during the trip, making driving unsafe. Emergency medical teams can begin assessing the patient on the way to the hospital and alert the hospital before arrival. In our final section, we'll discuss practical lifestyle habits that may help lower stroke risk, review the most important lessons from today's video, and leave you with a few simple steps that can help protect your health in the years ahead. Let's finish with one of the most important parts of this conversation. While no one can completely eliminate their risk of stroke, there are many everyday habits that can help support brain and heart health. Small, consistent choices often make a bigger difference than dramatic changes that are difficult to maintain. One of the best places to start is by knowing your blood pressure. High blood pressure is one of the strongest risk factors for stroke, and many people don't realize they have it because it often causes no symptoms. That's why it's sometimes called the silent killer. Having your blood pressure checked regularly and following your healthcare provider's advice if it's elevated can play an important role in reducing stroke risk. The next habit is staying physically active. You don't need to become a marathon runner. Even a daily walk, gentle stretching, or strength exercises approved by your healthcare provider can help support healthy circulation, improve balance, and maintain muscle strength. If you've been inactive for a while, start slowly and build up over time. Healthy eating also matters. A balanced eating pattern that includes vegetables, fruits, whole grains, beans, nuts, lean sources of protein, and healthy fats can support heart and blood vessel health. At the same time, it's wise to limit foods that are highly processed or very high in salt, added sugars, and unhealthy fats. Small improvements made consistently often easier to maintain than strict diets. If you have diabetes, keeping your blood sugar within the range recommended by your healthcare team is another important step. Over time, poorly controlled blood sugar can damage blood vessels and increase the risk of stroke and other health problems. Regular checkups, prescribed medications, and healthy lifestyle habits all work together. Don't overlook the importance of sleep. Many older adults accept poor sleep as a normal part of aging, but persistent sleep problems deserve attention. Conditions such as sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep, can increase the risk of high blood pressure and stroke. If you snore loudly, wake up gasping for air, or feel extremely tired during the day, Talk with your healthcare provider about whether further evaluation is appropriate. If you smoke, quitting is one of the most valuable gifts you can give your brain, heart, and lungs. It's never too late to benefit from stopping. If quitting feels overwhelming, remember that you don't have to do it alone. Your healthcare provider can discuss programs, counseling, or medications that may improve your chances of success. It's also important to take medications exactly as prescribed. Some people stop taking blood pressure medicine or blood thinners because they feel fine. But these medications often work quietly behind the scenes to reduce the risk of serious complications. Never stop or change a prescribed medication without first speaking with the healthcare professional who manages your care. Regular medical checkups become even more valuable as we grow older. These visits aren't just about treating illness. They're also about preventing problems before they become emergencies. Your healthcare provider can monitor blood pressure, cholesterol, blood sugar, heart rhythm, and other factors that influence stroke risk. There's another habit that doesn't receive enough attention. Learn your family's medical history. If close relatives have had strokes, heart disease, or diabetes, sharing that information with your healthcare provider can help guide appropriate screening and prevention strategies. And don't forget your brain itself. Staying socially connected, learning new skills, reading, solving puzzles, or simply having meaningful conversations with friends and family may help keep your mind active. While these activities cannot prevent every neurological condition, they are valuable parts of a healthy lifestyle and support overall well-being. Now, let's quickly review the 7 warning signs we discussed today. First, sudden weakness or numbness, especially on one side of the body. Second, sudden trouble speaking or understanding speech. Third, sudden vision changes, including blurred vision, double vision, or vision loss. Fourth, sudden dizziness, loss of balance, or difficulty walking. Fifth, a sudden, severe headache that feels very different from your usual headaches. Sixth, sudden confusion or difficulty thinking clearly. And seventh, a transient ischemic attack, or mini-stroke, where symptoms appear briefly and then disappear. Even if those symptoms last only a few minutes, they should always be treated as a medical emergency. If there's one message I hope you remember from today's video, it's this: never assume that sudden neurological symptoms are simply part of getting older. Healthy aging doesn't usually happen suddenly. A stroke often does. Acting quickly could protect brain function, preserve independence, and even save a life. You don't have to diagnose a stroke yourself. That's the job of trained medical professionals. Your job is simply to recognize the warning signs and seek emergency medical care without delay. It's always better to discover that the symptoms had another cause than to ignore a stroke that needed immediate treatment. If today's video helped you better understand these early warning signs, I hope you'll remember them not only for yourself but also for the people you care about. Sometimes a spouse, neighbor, sibling, or close friend notices the symptoms before the person experiencing them does. Sharing this knowledge could one day help someone receive treatment sooner. I'd also love to hear from you. How old are you? And which country are you watching from? Have you or someone close to you ever experienced a stroke or a mini-stroke? If you're comfortable sharing, your experience may encourage and educate others in our community. And before you go, tell me which of these 7 warning signs surprised you the most. Your comments help create a supportive space where people can learn from one another, while remembering that every person's health journey is unique. Thank you so much for spending this time with me today. I truly hope you found it helpful, reassuring, and worth sharing with someone you love. Until next time, take good care of yourself, stay informed, stay active, and remember that paying attention to small changes in your body today may